Late Night Health continues. During the second half of this hour, we're going to spend some time with a young woman who has designed an exercise program primarily for women who may have not the skinny size 3 or size 4 bodies, but are more in the size 14 body. And that'll happen in about 25 minutes from now. Right now, we go to Connecticut, and we speak with Abbey Meyers, whose book is a memoir. It's Orphan Drugs, a Global Crusade. Abbey, welcome to Late Night Health.
Yes, thank you.
And
nice to be here.
You're also the past president of the National Organization for Rare Disorders. It's known as NORD. And we're talking about the launch of your new book. What led you to write the book and start NORD?
Well, the need to start NORD was evident when a number of doctors from academic institutions had invented treatments that worked on people with certain rare diseases, and no pharmaceutical manufacturer was willing to develop those drugs and put them on the market. And when we asked why, they said, well, you know, it's a supply and demand problem, and
they're not going to make enough money, is basically
yeah,
it.
Well, the size of the market was so small that they felt they couldn't make enough money. It would cost them more to develop the drug and get it approved by the FDA than they would be able to make once it's on the market.
This is a personal...
And so there needed to be legislation to solve the problem. And that legislation was the Orphan Drug Act, which provided financial incentives to companies that develop drugs for rare diseases. And initially, it didn't work so well until about a decade after it was passed, and suddenly companies began to understand that they weren't going to lose money if they developed an orphan drug. They would certainly be able to make money, and they'd be able to make a profit. And as time went on, the profits became huge. Because very expensive drugs got on the market. And even though they were sold just to a small number of people, they were priced so high that companies were able to make a lot of money.
This is a personal campaign for you. Can you tell us about that, please?
Well, I became interested in it when my son, who had Tourette syndrome, was taking an experimental drug that worked on him. And when we had to keep going back every 3 months to the doctor to get a new supply, and when we walked in this last time, the doctor said, I can't give you any more. The drug was being developed for a common disease. It didn't work on that disease, and so the manufacturer decided not to develop it. And when I said, but, you know, it works on Tourette syndrome, why don't they keep it, you know, develop it for Tourette syndrome? And they said, no, the market would not be big enough.
Well, pharmaceutical companies are designed to make money. We know that. But
yes, every company is designed to make money, except the nonprofit.
Now you tell me. I should have called you first. Abbey, you know, I don't out of the population, and I don't know if you know this or not, but what percentage of the people have Tourette syndrome? Say out of 100 people, is it less than one? Or
no, the National Institute of Health estimated at that time that there were 100,000 people in the country with Tourette syndrome.
So it's a very small percentage of 300 million people. 300
million, yeah.
Right.
That's right.
And at the same time, over half of those people have blood pressure or fat. Diabetes is growing, so that their market is obvious. They want to lower blood pressure, and they want to prevent diabetes and work on those rather than do a drug for 100,000 people. Doesn't seem
exactly
right. Doesn't seem right to me. Doesn't seem to be part of the
no,
community.
But if you think about it from the point of view of a business person, they are going to think that, no, our responsibility is to our our stockholders, etc. And you have to look at all of their excuses and say, wait a minute, you're not in the bicycle business. Nobody's going to die for lack of a bicycle. And if you make a bicycle and decide I'm not going to make it for three-legged people, I can understand it. But when it comes to medical problems, it just seems so ironic to say no to some people. We're not going to develop this drug because there aren't enough of you, and yet develop something for cholesterol. If you look at cholesterol and how many millions of people have trouble with cholesterol, maybe there's 50 drugs on the market for cholesterol. But if you could just get a tiny part of that market, it's going to be a big seller.
How long?
So that's really what they're looking at.
How long have you been involved in this crusade?
30 years.
And
it's been 30 years.
And how is your son today?
Oh, he's fine. He's very well. Actually, he's on a high blood pressure medicine that controls his symptoms, and he's been doing very well.
That's terrific. How old is your son? 30? Or in his 30s?
No, he's closer to 50. And I have a daughter who's in her 30s, and she also has Tourette syndrome.
Oh, my. Does she use the same kind of drug?
Yes. She's also on a blood pressure drug that controls the symptoms.
In these kinds of rare disorders, and there are numerous, how do we develop those drugs for those people? Or treatments? It doesn't. I mean, as long as it works, as long as it stops the Tourette's. I mean, I don't think you would care if it was an herb, a shot, a pill, as long as the kids are okay.
That's right. When you've got a very serious chronic disease, yes, anything. But many of the diseases are life-threatening. Hemophilia only affects 10,000 people in the United States. Cystic fibrosis only affects 30,000 people in the United States. These are diseases that everybody knows but doesn't realize that they're rare. And, developing a treatment for them is very challenging because when you test it, you have to test it on a number of people that makes the results statistically significant. You can't just test it on 5 people. And so it's a challenge. And what happened with the Orphan Drug Act is it gave them financial incentives. It said, if you develop a drug for one of these diseases, you can get 7 years of exclusive marketing rights, which means nobody can compete with you for that drug for that disease. They could develop another drug for that disease, but not the drug that you've developed.
And what is the
years you have
for if I have a regular drug for blood pressure? What is the exclusivity on that?
Well, you get a patent for 20 or 25 years, but many years go by since you file for the patent until the drug finally gets on the market. With exclusivity for an orphan drug, the exclusivity starts on the day the drug is approved for the American market, not for all the years that you've been experimenting with the drug. And so for 7 years to have a monopoly, it's an extraordinary incentive that it's worked very well. There were also tax incentives.
Gotcha. Just what pharmaceutical companies need. The pharmaceutical industry is huge business. We've done some discussion recently on cancer drugs, where the pharmaceutical industry are making so much money on oncology that they really have no interest in curing cancer. They just want to keep it going. It's a money-making
Oh, no, I
machine.
think that's wrong.
Do you?
That's wrong.
Do you?
Oh, yes. First of all, most cancer drugs that have gotten on the market in the last 30 years, most of them are orphan drugs because there's over 200 different types of cancer, and most of them are rare. They affect fewer than 200,000 people. There's only 5 or 6 cancers that are common, breast cancer, lung cancer, prostate cancer. There's only 5 or 6 of those diseases. And so anybody who develops a cure for cancer or a preventive for cancer is going to make a gazillion dollars. There's no question about it.
It should happen to us.
But there is not one type of cancer. Nobody's going to find a magic bullet. You have to look at 200 different types of cancer.
Well, we're going to continue our discussion. We're talking with Abbey Meyers, whose memoir, Orphan Drugs, A Global Crusade. She's the founder of NORD, which is the National Organization for Rare Disorders. And we'll continue our discussion in just a couple of moments. In about 12-15 minutes from now, we'll be spending some time with Kat of Catnap Fitness. And we'll talk to her about exercising for those of us who are a little portly. I think I'm being kind. All right, more coming up. Don't go away. Late Night Health continues. Join us at latenighthealth.com. Latenighthealth.com will have a picture of Abbey up there, as well as a link to the organization and the book. All right, more coming up. Don't go away.
Late Night Health continues in a moment.